Good morning, students. Today we will discuss about National Tuberculosis Elimination Program. This lecture is in English, and if you want to study in Hindi, wait for next class. First of all, whenever you get this question in your examination that what is National Tuberculosis Elimination Program, then you should start from the history, that what happened about tuberculosis in India. The National Tuberculosis Program (NTP) was launched by Government of India in 1962, and despite full efforts under National Tuberculosis Program, the treatment success rate was unacceptably low, and the deaths and default rate remained high. Okay, deaths were more, and actually default rates were more because the treatment is very lengthy. So patients tend to leave the treatment in between. This is known as default. And in view of this situation, in 1993, Government of India launched a revised strategy and renamed the program as Revised National Tuberculosis Control Program (RNTCP). RNTCP activities are implemented in phased manner. It was started as a pilot project in 1993 in selected districts, and large-scale implementation began in 1998. The RNTCP has expanded rapidly over the years, and 30% population was covered by the year 2000, 80% population covered by the year 2004, and by the year 2006, whole country was covered under RNTCP, where DOTS program was implemented, directly observed treatment, short course. Later on, to eradicate tuberculosis from our country, Government of India renamed the program. In January 2020, Government of India revised RNTCP to National Tuberculosis Elimination Program, and in 2021, means next year, TB Mukt Bharat Abhiyan was added to it. So we can say presently the same program have two names, NTEP and TMBA, National Tuberculosis Elimination Program in English, and we call it TB Mukt Bharat Abhiyan in Hindi. And the slogan is TB Harega, Desh Jeetega. What is the strategy or activities under National Tuberculosis Elimination Program? NTEP has 4-point strategy: detect, treat, prevent, and build. Now we will discuss them one by one. What is this? Detect means find all TB cases with an emphasis on reaching every TB patient, even in the private sector. Treat all TB cases with high quality anti-tuberculosis drugs. Prevent the emergence of TB in susceptible population and stop catastrophic expenditure due to tuberculosis by all. Then build and strengthen the supportive system, including enabling policies, empower institutions or hospitals, we can say, health centers, and human resources, means staff. So what we have to do under these strategies, we will discuss one by one. First is detect. So here we have to find the cases, and for this we need to decentralize TB screening to ABHWC, means Ayushman Bharat Health and Wellness Center level. So we can start screening from in these health centers. Then scale up molecular diagnostic to the peripheral level, to different health center levels. Then early detection of drug resistant TB and universal drug sensitive TB. Then vulnerability mapping and active case finding in the community as well. And then we will also engage private sector in the detection or finding the tuberculosis cases. Then we have to treat. What we will do here? Daily regime, fixed dose combination of anti-tuberculosis drugs to be given, sustained treatment success rate more than 90% according to this program, injection free treatment regime means only oral drugs, and then scale up newer drugs regime if possible. So this is the second strategy, that we have to treat the cases as early as possible with effective drugs. Then prevent. For prevention, we have to do many activities. For example, number one, sustain COVID appropriate behavior. So what was COVID appropriate behavior? Means to maintain a distance and using the mask. So by these measures, we can prevent even transmission of tuberculosis. Then contact tracing and TB preventive treatment. So contact tracing means the person who came in contact with the tuberculosis patient before starting treatment. So we have to check them, and we can give them preventive medicine, and then we can screen them also. Then airborne infection control in the community and health facility. So, and as you know, for this we can use all the COVID appropriate behavior. Then community mobilization and people's movement through IEC activities, and we have to involve community for the prevention of tuberculosis and spread awareness about the preventive activities. Then build. We will strengthen our activities through IEC. We will spread awareness. Then capacity building of institutions, hospitals and health centers. Human resource development, mean training of staff, nurses, doctors regarding all these strategies, prevention, treatment and detection. Then multi-sectoral collaboration, different ministries, different departments have to come in close coordination for elimination of tuberculosis from our India. Then digital interventions, as you know that we have app or website Akshay, through which we are monitoring and we are providing special services for the tuberculosis patient. Then surveillance. Surveillance is very important regarding completion of treatment, prevention of disorder and early detection of cases. And procurement and supply chain management means there should be never shortage of medicine. For this we have to do or strengthen our health system. One more important aspect of this National Tuberculosis Elimination Program is Nikshya Poshan Yojana. Actually, this Nikshya Poshan Yojana was started by Government of India on 1st April 2018, and now it is continued under National Tuberculosis Elimination Program. Under this scheme, all registered TB patients are entitled for 500 rupees monthly for healthy nutrition, and this amount is transferred directly into their bank accounts. Thank you, students. This is all about National Tuberculosis